Hi, welcome to Pathology Riddles. In the previous video, we learned about the definition of edema and the pressures controlling the inward and outward movement of fluids from the capillaries into the extracellular tissue spaces. Today we will discuss about the mechanisms which cause edema. If you haven't watched the previous video, the link has been provided. So there are 5 mechanisms that cause edema. Mechanism 1. Increase in hydrostatic pressure. We have seen that hydrostatic pressures at the arterial end is around 32 mm of mercury and that at the venous end is around 12 mm of mercury, while the capillary osmotic pressure is around 25 mm of mercury throughout. In cases of congestive heart failure or deep vein thrombosis, the venous return to the heart is impaired. So there is a backflow of fluid which causes increase in the hydrostatic pressure at venous end and arterial end of the microcirculation. This will create an increased pressure difference which causes excessive fluid to move out from the arterial end and reduced fluid going inward at the venous end as the venous end hydrostatic pressure is high. This causes edema. Second mechanism, reduce plasma osmotic pressure. As discussed in the previous video, albumin accounts for most of the plasma osmotic pressure in microcirculation. Therefore, conditions leading to inadequate synthesis of albumin like liver cirrhosis or malnutrition and conditions causing increased loss of albumin from microcirculation like nephrotic syndrome or protein losing gastroenteropathy results in decreased plasma colloidal osmotic pressure, which leads to increased pressure difference and hence edema. Third mechanism, sodium and water retention. Conditions like excessive salt intake with renal insufficiency or increased tubular reabsorption of sodium results in increased salt retention. This increases water retention, leading to both increased hydrostatic pressure, which is due to increased intravascular fluid volume expansion, and decreased vascular colloid osmotic pressure, which is due to dilution. Now these two combine and cause edema. Fourth mechanism, lymphatic obstruction. As we have learned that lymphatics keep extracellular fluid in the tissue spaces in check. Any obstruction to the lymphatics due to trauma, fibrosis, invasive tumors, and infectious agents will lead to edema. Mechanism 5. Increase vascular permeability. In conditions like inflammation and sepsis, the space between the endothelial cells lining the vessel increases. This allows the escape of more fluids from the intravascular compartment into the interstitial tissue spaces, which causes edema. So we spoke about 5 mechanisms causing edema. To summarize, 1. Increased hydrostatic pressure, for example, congestive cardiac failure, deep vein thrombosis. 2. Decreased plasma osmotic pressure, for example, liver cirrhosis, nephrotic syndrome. 3. Sodium and water retention, for example, renal hypoperfusion, increased salt intake with renal insufficiency. 4. Lymphatic obstruction, for example, filariasis, post-surgical. Mechanism 5. Increased vascular permeability, for example, inflammation, sepsis. So that's all for today. This is Dr. Usmle signing out. till we meet again in the next video. Goodbye.